For the people tracking the numbers, how bad do they see cases rising in the next few weeks and what should be done to arrest that? To talk more about this, we have OCTA Research Fellow Guido David. Professor David, welcome to the big story.
Yes, hi, good evening, Robbie and Gretchen.
Hey, Professor David, one thing that was mentioned, the higher transmission rates in the households, you're particularly concerned about minors. But what's the context with minors? Are they at home or not? Are they going out or not? How is it that it is the minors that we have of this particular concern?
Well, that's a good question, Robbie. I'm not outside most of the time to know if they are going out. I do have seen some minors outside sometimes when I go out, so that's just anecdotal. Perion, based on the other variants that we're looking at, they report more household transmissions and more transmissions to minors, or more infections with minors. So that's one of the bases, but we are actually seeing it in the data.
Okay. Now, when we talk about minors, obviously we're talking about behavior of people. Government has been saying, look, let's not be lax, and they keep emphasizing, again, the behavior of people. But how much of this is in fact being driven by the new variants?
Well, that's a good question, and it's really difficult to answer that considering that we have very limited biosurveillance because, of course, biosurveillance and genome sequencing takes a lot of resources, and which we don't have. A country like UK, they can do genome sequencing for all their cases, siguro, pero not in the Philippines. So the best that we can do is maybe get a sampling of prevalence of these variants. But for sure, we have seen that there are some UK variants in Metro Manila, and then a few South African variants. But what we are seeing based on the numbers is that this is a trend that would not be possible if it was just the original variant that was spreading, what we call the D614G. So we don't think that version of the virus is capable of spreading this quickly, especially to households and minors, because we haven't seen that kind of event happening before. So now that we're seeing this, it means that maybe the game has changed, the rules have changed, and that's why we must be now more careful about, and more strict about our health protocols.
Dr. Guido David of the OCTA Research Group, maraming salamat po.